Special gift for you. He's probably a Cubs fan, but we're going to change this. We're going to convert him.
Well, thank you, Governor. I am honored, and I will wear this with pride, even though I still might watch the Cubs.
It's all right.
Thank you, Governor.
Dr. Shah, would you like to give your report?
I'd be delighted. Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm here to join everyone today, as well as with Governor Mills, to provide an update on the COVID-19 situation across the state of Maine for today, Monday, May 18th, 2020. And sadly, Maine CDC is reporting the 71st death of an individual with COVID-19. She was a woman in her 80s from Cumberland County. We, all of us here at the state of Maine, offer the family of this individual our deepest condolences during this time of their grief. May her memory endure with them always. Overall, Maine CDC is reporting 1,713 cases of COVID-19 across the state, representing an increase of 26 cases from yesterday. Of those cases, 1,533 have been confirmed by a laboratory test, and 180 are probable. Overall, 223 individuals have been hospitalized, and 1,053 are recovered, an increase of 25 recoveries since yesterday. Since we began our activation, Maine CDC epidemiologists have now fielded over 7,000 consultation requests, and our colleagues over at 211 have now fielded 15,428 phone calls from Maine residents asking questions about the current situation of COVID-19. Of our 1,713 cases, 380 are among healthcare workers. Wow. I'd like to provide a really quick update on some of the outbreaks that Maine CDC is most actively engaged in right now before turning things back over to Governor Mills. This morning, Maine CDC was identified of an outbreak at the Blue Star Home Care Facility, where there is one resident and 2 staff members who have been identified as having COVID-19. In addition, we, over the weekend, began working with Bristol Seafood, where they have identified staff members very promptly and are in the process right now of collecting additional samples today that will be sent up to the Maine CDC laboratory for testing. Our colleagues at Bristol Seafood have voluntarily paused production, and Bristol is working very closely with epidemiologists and infectious disease investigators at Maine CDC. Bristol took a number of early steps starting in March to get on top of the COVID-19 situation, and we thank our colleagues there for the close collaborative relationship that we've had in order to keep employee health above all else as our top priority. In addition, at the Clover facility, there have now been 1 resident and 4 staff members who have tested positive for COVID-19. Given that outbreak, the facility is now commencing with universal testing and sending samples to Maine CDC's laboratory in waves. Overall, there will be 550 samples that will be tested over the coming day or two, 200 of which have been tested thus far. And finally, at the Chimbro construction site, there have been now a total of 19 individuals across many states who have been identified, and our epidemiologists are conducting an investigation which is underway. The central question in that investigation was what direction the transmission went. Did people from other states bring it to Maine, or did they acquire COVID-19 while they were in Maine? Much more to come on that as our investigation proceeds. Governor, I'd like to hand things over to you for today's announcements.
Thank you. Thank you, Dr. Shah. Thank you for your update and for your continued leadership at the Maine CDC. The people of Maine are all grateful, and we often hear you express gratitude for others, and I will say that we are all grateful for you and your staff.
Thank you.
Today, I'm pleased to announce that the Maine CDC has eliminated its testing prioritization system, and as a result, Healthcare providers across Maine are now able to order testing for anyone they suspect of having COVID-19. That has not yet been the case up to now, and this is a welcome step forward. Before now, healthcare providers adhered to a testing prioritization system, a tiered system, that, like most other states, Maine had to implement this to preserve vital testing materials as a result of the very limited national supply. Under that system, up to now, healthcare providers were asked to prioritize their testing requests for people in high-risk categories. They had to be symptomatic for COVID-19, and second, they had to fall into a high-risk category, like had to be in the hospital, had to be a healthcare worker, had to be a first responder, had to be living in a congregate care setting like a nursing facility, and had to be older than 16 or have an underlying medical condition. All of these things played into whether or not you could even get a test. For a lot of people in Maine, that tiered system, although it was necessary for Maine and most other states, it meant that even if you were symptomatic, you might not be able to get a test. Earlier this month, though, as you know, our administration reached an agreement with IDEX Labs, an innovative diagnostic company that employs 3,000 people here in the state of Maine, in Westbrook. The agreement to more than triple the state's testing capacity, as we announced a week and a half ago. So Maine CDC staff has spent the last week working closely with IDEX, and I'm pleased to say that our new expanded testing capacity is now operational. Thank you, Dr. Shaw. Again, as a result of this, Maine CDC has informed healthcare providers today that we have eliminated these categories to allow for testing of all people in Maine with symptoms, as well as some without symptoms. For instance, people who are in close contact with people who have confirmed positive tests, or healthcare workers who are in contact with a confirmed case, and people tested as part of our spot checking plan that is under development. This breakthrough will also allow the state to continue to implement universal testing in congregate living settings that have an outbreak, such as nursing facilities and shelters, and such as some of the testing that Dr. Shaw just announced earlier. However, I continue to believe that more testing is necessary, and I know that Health and Human Services Commissioner Jean Lambrew and Dr. Shaw continue to work very hard to bring more options online that will further expand our testing capacity. It's so critical, not only to the health and safety of Maine people, but to our economy. Meanwhile, in 12 of our 16 counties, specifically those 12 counties that do not have confirmed community transmission, restaurants today are beginning to reopen with significant new health and safety precautions. These include physical distancing measures and enhanced cleaning practices. My first job as a kid was working in a restaurant, and in college I worked in restaurants. And I know it must be extremely difficult to accommodate these new precautions, being 6 feet apart from somebody else, from other employees, trying to not handle cash, washing your hands so frequently, using hand sanitizer, keeping customers 6 feet apart, tables 6 feet apart. It's going to be very, very challenging. We know that. But the last thing that we want to have happen is for customers and staff to not feel confident going to your restaurant, to not feel confident that they can be safe. The last thing we want to have happen is for anybody to get sick, to be tested positive with COVID-19 because they worked at a restaurant or because they had dinner at a restaurant. And also we encourage outdoor dining with the same 6-foot distancing, social distancing practices that we recommend for all facilities and all activities. So I'm asking the members of the Maine public to please be patient with our businesses and with our restaurant staff as they get staffed up and as they work to modify their businesses to keep you and them safe. As Maine's economy begins to restart, and as we continue to enhance our testing and our contact tracing capabilities, I urge Maine people also to continue abiding by the same practices that have spared our state from the surges we've seen in other states. Physical distancing measures that have prevented us from overwhelming our hospitals, hand washing and good hygiene, and staying at home to protect our frontline workers, ourselves, and our fellow citizens. Staying at home. It's a beautiful day out there today, and it's been a beautiful weekend, and there are beautiful days to come. And it's very inviting, very enticing to want to take a drive or walk on the beach or go somewhere where you'll have fun. But the critical thing is, especially if you're over 65, especially if you have diabetes, asthma, obesity, hypertension, or a member of your family does, please take extra precaution. Stay out of public places. Stay home as much as you can. I've said it before, and I will continue to say, we have to face the hard reality that as much as we would like to, we're not going to be able to return to the way things used to be, the way things were, not anytime soon. Instead, we all have to invent and reimagine ways of doing business, ways of doing activities. Staying connected while being apart. Shopping while staying protected. Eating out while staying safe. Living our lives with this continuous threat of the virus that remains around us. That's the test before us now. And it's up to each of us as individuals and as members of the larger community, a very caring, compassionate community that is the state of Maine. It is up to all of us to determine how successful we will be. Throughout all of this, I ask again, let's be kind, let's be compassionate, and understanding of one another and of our business community. For generations, Maine people have shown grit, resilience, and unmatched kindness in the face of terrible challenges. Let that spirit continue to define us during these difficult times. Thank you, and I will now take questions, and if you would also, from members of the media.
Great. Thank you, Governor. Today's first question goes to Isha from the BDN. Go ahead, Isha.
Hello, can you hear me?
Yep.
Hi. So my first question is that we've been seeing the number of active cases rise in recent weeks, and the positive test rate has remained more or less the same. So is Maine proceeding with the reopening plan as it was outlined, or is there reason right now to change the pace of the reopening?
Is there so did you say, is there a reason to change the pace of reopening?
Yes, based on the cases right now.
I think I got the gist of your question. I think we still have a very low positivity rate. We outlined 3 basic general measures a couple of weeks ago when we talked about the rural reopening plan and rolled out that. We talked about the level of new hospitalizations, the levels of flu-like symptoms and COVID-19 type symptoms, and our capacity, our healthcare capacity, the number of hospital beds, ICU beds available, ventilators available. I believe, and correct me if I'm wrong, Dr. Shah, that those things remain pretty stable. There's increased numbers of positive tests overall because of increased testing. Mm-hmm. But if you care to chime in and explain that, I'm happy to.
I'll add on top of what Governor Mills noted that many of the cases that we've detected and confirmed in the past week or two have been linked to ongoing outbreaks. For example, many of the cases have been very close household contacts of individuals who are associated directly with outbreaks. Those are individuals that may have otherwise been in the probable category before. That is to say, they always had it. But now, because of more testing and even more testing starting this week, they are not just probable cases, but confirmed cases. So it's a bit of both. It's goes back to that old adage that when you go out and look for things, we find them. So thanks for that question, Isha. We're going to turn next to Emily Tadlock at WABI.
Hi.
Hi, Dr. Shaw and Governor Mills. My question is kind of for both of you, and it's kind of going off of Isha's, but there have been reports that the state of Maine is not hitting different benchmarks that have been recommended by the White House and other health experts to safely reopen. What do you have to say to all of that?
I'm not sure which benchmarks you're talking about. You're talking about downward trajectories. I think we've hit basically a plateau, and the plateau is a low-level plateau. I think we're in a different place than other states, a better place than other states right now. The challenge before us in the coming weeks, even the coming weekend, and coming months is, unlike many other states, Maine is looking at an increased tourism population. We have 1.3 million people here. We look at a surge generally of 10 million people coming into our state over the summer. That's what we're trying to prepare for as best as possible. In terms of benchmarks, I'm happy to.
Emily, again, I'll add on top of what Governor Mills noted that we have always taken a holistic approach to looking at all the benchmarks in unison with one another and not just any one particular benchmark. It's true that the number of cases that we've observed in the past week or two has been rather steady. But I think in public health, what I think about are anticipated increases versus unanticipated increases. And we've known that as more testing has come online, and again, a big jump forward even today, we will continue to see cases. But that's different from knowing that there's more transmission. Many of the cases we've detected would have always been there. We're just now seeing them, finding them, confirming them. It's an anticipated increase, which distinguishes it from a new surprise. That's what's happened in many other states for quite some time. We're not done there, though. We are hoping and to work with providers to get even more testing rolled out across the state so that providers have security in knowing that if they've got a patient who is a close contact and say they were previously worried about resources in terms of whether to send that patient in for testing, they shouldn't have to worry about that anymore. So we're always looking at all of these variables rather than just one unique one at any one time. I'm going to turn.
Dr. Shaw, I think one of the other things that I kind of wanted to get in there with that was testing for testing asymptomatic individuals as well to help, limit the spread and in case of a resurgence, identify those people. And some of the reports are saying that there's not enough testing to even do any of that right now. I know you were just saying your hope is to increase testing. I don't know. I'm not sure. I just want to get it answered for people if you feel like we have enough testing now to safely reopen and stop a resurgence if it does happen.
So I can't comment on the reopening link because there's many factors that go into that. But when it comes to testing of individuals who have been exposed to COVID-19 or who may be suspected of having COVID-19, even if they are asymptomatic, today's announcement equips us to conduct those tests in a way that we could not and did not have the capacity to do as early as 72 hours ago. So with respect to asymptomatic testing of individual patients who have been exposed to COVID-19 or who a physician or healthcare provider thinks may have COVID-19, even though they don't have any symptoms, our testing capacity today's announcement, equips us to run those tests.
And I think the question talks about reopening as if it's one thing, as if we're flipping a switch and we're going to go back to where we were in January, February, and everybody will be doing business as usual the way it was. And that's not true. We've been working so deeply, heavily with the tourism industry, with the meals and lodgings people, with the restaurants, with the gym owners, with dog groomers and beauty salons, so that just reopening is really a bit of a myth. What it's doing is allowing people to reopen and do business, make some money again, and people can get their hair cut again and do some exercise outside and whatnot, have a meal outside, but with a lot of precautions. These checklists, and I invite you all to go online to the DECD COVID-19 checklist, prevention checklist. If you are a customer of a store or restaurant, check the checklist and make sure you know what they're supposed to be doing, because it takes all of us to engage in prevention. We're not taking anything for granted. When we say reopening, it's a pretty limited, pretty restrictive paradigm here.
You bet, Emily. We're going to turn now to Amy Brown over at WERU.
Thank you, Dr. Shaw. I have a question for both of you, or one for each of you. a listener, for Dr. Mills, or Governor Mills first, a listener contacted us about a situation where an assisted living facility is trying to evict someone for non-payment while their Maine Care app is being processed. Does your order that's delaying evictions apply to assisted living facilities and long-term care facilities?
I can't answer that question. I think if there's a specific situation, I have not heard about anybody being evicted from a nursing home or long-term care facility for non-payment of rent. If it's a usual rental, month-to-month rental, for not a skilled nursing facility, but a non-medical rental unit, then it may well come under our eviction executive order, keeping in mind also that the courts are not open for most of those matters. If it's a medical facility and there's Medicaid medical treatment involved, that's a different issue. I can't answer that, whether or not somebody's specifically qualified or whether they can be terminated from care.
Okay, well that may clear it up.
I
Thank you.
invite the person to call the long-term care ombudsman, whose number is a 1-800 number on the website of the DHHS.
Okay, great, thank you. And Dr. Shaw, there have been reports of people recovering from the virus.
We lost you.
Yep. Amy, I know your question was about, the beginning was about reports of recoveries. And I think I know where you're going with that, about reports of reinfections, but we'll come back to you in just a minute, Amy, if that's all right. And in the meantime, turn to Patty White at Maine Public.
Hi, thanks so much. I've got a question for each of you. I guess I'll start with you, Dr. Shaw. So the state can now run 7,000 tests per week through the state lab. When you add in the commercial lab capacity, how many is that? And then what's the higher number that you want to achieve? I think Governor Mills said that, even though we've increased a lot with these IDEX tests, you want to go even higher. So what is that number, and what would that allow you to do?
Mm-hmm. So Patty asks about the capacity of non-state laboratories and where that's headed, and then what is our overall goal for testing. So the first question, Patty, is that it seems like every few days the commercial laboratories, multi-state commercial laboratories, Quest, LabCorp, Mayo, Arup, those entities are expanding their own capacity. The last time we had a conversation with folks at Quest, they indicated that they too could probably handle about 1,000 per day from Maine, perhaps even more. And I know that LabCorp itself is expanding their capacity. It's very much a moving target about what the non-commercial laboratories in the state can do. I'm sorry, the commercial laboratories. On top of that, a number of hospitals in the state of Maine are also conducting testing at their own facilities. I think I mentioned a couple days ago I had a call with the CEO of Cary Medical Center, and they are offering testing within their own facility as well. So hospital level testing is increasing. So where do we want to go as a state? And my goal remains to get the state to a positivity level of something on the order of about 2%. So it's less about the total number of tests, although that's obviously a piece of it, but what percentage of those tests are positive. There are other goals out there that have been set by various epidemiologists, including epidemiologists at the CDC and the White House, that suggest approximately 2% of the population every month should be tested, which in Maine would be about 26,000. Patty, as your question notes, our laboratory alone at the Maine CDC would be able to attain that with our 7,000 tests per week. So, it really, I look more at the positivity rate as opposed to any one particular number, but that 2% figure, which again the US CDC and others have looked to, is one that there's a lot of discussion around.
I'm going to interject to say I have to leave in about 5 minutes to do a governor's only phone call, but people have questions for me, please.
Yeah, thanks, Governor Mills. I wanted to ask about the 14-day quarantine for out-of-state visitors, and I know that the hope is that people will comply so that the state doesn't have to focus on enforcement, but I'm wondering, if there is an instance where enforcement is needed, if say, someone comes here and they don't comply with the quarantine and they're staying at a hotel and they end up making people sick, who would be held accountable for violating the order in that situation? Would it be the out-of-state visitor? Would it be the hotel? Or would it be both?
Well, thanks for the question, and it's not a simple one. The answer isn't simple. There are multi-levels of enforcement, and I can't speculate on who might be liable if the precautions and the checklist measures are not complied with. That's somebody else's call, not mine. That's the lawyer for the entity. But if somebody gets sick and comes here, I've actually heard of cases where people have come here to Maine to visit relatives and whatnot and have self-quarantined for 14 days and without symptoms at all. During that quarantine period, have come down with symptoms and ultimately tested positive for COVID-19. So the quarantine worked. It helped keep other people safe, and it helped that individual acknowledge her condition and get treatment, get help, not treatment, but help in the meantime. So it works, and that's why 34 other states adopted a 14-day quarantine. Getting away from that is very challenging. We are working on some alternatives, some way to not enforce the 14-day quarantine, but allow people to be tested, allow people to conform to various precautions. But we're not there yet. In terms of enforcement, look, the health inspection people in DHHS are there to inspect restaurants and other facilities. The food inspection people, the local code enforcement officers are there to inspect and monitor for occupancy matters for lodging and food. Every town has a health local health officer. They are there as a recourse, and law enforcement is potentially there as a recourse. I'm not saying we're going to try to arrest anybody for violating the quarantine, but there are many levels and layers of potential enforcement.
Thank you.
Was that? Okay. Yeah, please.
The governor has to leave, so I think we've got time for one more question for her. And next on the list is Kevin Miller from the Press Herald.
Yeah, thank you very much for the opportunity to do this. Actually, my question was for Dr. Shaw.
Okay.
Gotta
Kevin, we'll come back to you, Kevin, I promise.
Yeah, thank you.
Yeah, that's
next
fine.
on the list is Pat Callahan. Hey, Pat, do you have a question for the governor?
Yes, I do, Dr. Shaw. Governor, it's fairly simple. I know
sure it
where
is.
you live, the restaurants are starting to open. When are you planning to go dine out at a restaurant again?
Oh, that's a cute question. Nice question. Look, I'm over 65. I'm going to be extraordinarily careful. I have been ordering takeout from my local restaurant, one of them, who just opened up a year ago, and excellent homemade food, by the way. It's salt and pepper and sugar, too, in East Wilton, Maine. But just to put in a plug. And I would love to go to a lot of other restaurants, like Helen's and Machias, and restaurants in Dover, Foxcroft, and other places. But I'm going to take it easy for now. I'm not planning to go out to dinner anytime soon. Thanks for the question. I'll keep ordering out some, though, on weekends.
Thank you, Governor. Dr. Shaw, while I have you, you were talking about the numbers, and the different people are giving different ideas of how many need to be tested. There was a report in the Press Herald yesterday about the Edmund Safra Center at Harvard suggesting that Maine would need daily testing of between 2,500 and 5,000 people and have 300 to 500 contact tracers to identify people who came into contact with the infected. Do those numbers make sense to you, and is that attainable?
Why don't you ask him if he's going out to dinner anytime soon? You gave me the fluff question. Not fair.
Well, I will get back to that question, Pat, but Governor, I know you have to leave. Do
Shaw.
you have any other?
I have no other comments yet today. I hope to be back tomorrow, the next day. Thank you so much
Great.
again.
Thank you very much,
Wear
Governor.
that Red Sox
I shall.
covering.
Yes,
Thank you.
Thank you, Governor. So Pat, I'm going to take your question, and then I'll bump back up and pick up some of the others. So Pat asks about some of the different reports and projections that have been made about the daily volume of testing that different states might need. Even within, say, Harvard University, there have been multiple groups that have put forth different projections. I believe the last time I took a look, there are 3 different groups at Harvard that have different estimates of what states might need to run. Some, and they vary quite dramatically. So I think what me and my colleagues in the other states are really taking a look at is looking at the overall positivity rate with tests. That tells us where we need to go. It also, I think just as importantly, gives us a sense of whether we're testing the right individuals. So it's partly important to cast the widest net, but we've also got to make sure we cast that net in the right place. And the positivity rate is a really good marker that helps us get a sense of what the overall, who we're testing and whether they're the right folks. We could test a lot of really, really low risk individuals and get a positivity rate close to 0, which wouldn't really tell us that we're doing anything right. So that's really the number that we look at. We're aware of a lot of those other reports that are out there. They have all produced a very wide array of tests. One in particular that was developed by a Nobel Prize winning economist, Paul Romer, recommends a number that's even significantly higher than that. So there are a wide array of testing plans out there. The question that we always think about in public health when it comes to mass testing is what is the background rate of disease that you're dealing with? In a situation where there's a lot of people that have a particular disease, mass testing makes sense. New York City, Boston, places of that nature. But in a state like Maine, where the overall prevalence is very low, we really have to think about the implications of mass testing because there will be false positives. And how do we think about those? We have to make sure we've got a plan in place before we set ourselves to testing a high number of asymptomatic people who have not been exposed at all. So as I've said, this is not a no, we're not going to do it. It's a let's think through all the implications before we go down any particular path.
And will you be going to dinner anytime soon?
Pat asks if and when I'm going to be going to dinner anytime soon. And to be totally candid with you, Pat, I think the honest answer for me is whenever time allows, I look forward to doing so. But the other piece of this, on a somewhat personal note, is my family and I love to cook. It is what we do. It's what brings us together as a family. And so as much as we love going out to dinner, probably our number one pastime in our household is getting up on Saturday morning and planning out what we're going to cook for the next 48 hours, and then Sunday night figuring out what we're going to cook for the next 5 days until we get back to Saturday. So I do look forward to getting back out at some point. I don't know when that will be, but certainly as we get into spring or summer and more fresh produce being made available, I'll tell you from my own family's perspective, we're looking forward to doing a lot more cooking. So that's that you got it. I'm going to go back up to Kevin Miller. I'm also going to switch over to the prior podium because that's where the speaker is as well to get a little better audio. And Kevin, I'm going to head back up to you, please.
Yeah, thanks again for coming back to me. 2 questions for you. First off, we've received a couple of reports now and seen some discussion about a potential outbreak at State Street Affordable Housing Complex in Portland, and that there was even a suggestion that there was enough cases there to trigger universal testing, but Maine CDC had not done that yet. Mm-hmm. Can you talk at all? Is that something that you're monitoring there?
It is, Kevin. So just about 45 minutes or so ago, but just coming up on an hour ago, I did receive word of just what you would receive word of. I know that our epidemiologists are looking into it to get the verified facts. We get a lot of reports of things going on, and then the process from there is that we take those reports, look at our computer entries of all the tests that have come in to make sure that what has been reported to us corresponds with a confirmed laboratory test. After that, we get on the phone with the facility or the operators to get a sense of what's going on and then make recommendations from that. I understand that process is going to be underway if it's not already underway. Based on what we learned from there, that's when the recommendations follow. But the information that I received is, at this point, maybe not even an hour old. So much more to come, and most likely I'll have more details on that tomorrow.
And then, great. And then a kind of two-part question. First off, just clarification. So are we completely up to 5,000 tests with the IDEX platform system now, or is there a little bit of lag time before we get up to that full number?
One clarification on your clarification. The anticipated weekly maximum capacity is 7,000 as opposed to 5. And then we are, I don't know what the percentage is. We're pretty close to being fully at that. We had to hire additional staff, go through the validation, but there might be a little bit on the IT side as the new increased volume comes in. There'll just be maybe a couple of hours of getting into a rhythm of getting results and then getting them back out to submitters. But we're pretty much there.
Okay, great. And then the one of our sister papers had reported that there was a retirement village in Bar Harbor, Birch Bay, that had tested all residents there. And this was done before there was actually a positivity test, and that was done as a recommendation from Maine CDC. Do you know anything about that case? And is that an example of where you're going to be doing universal testing of long-term care facilities, or was this was there something else going on in this case?
Similar to the former question about the State Street complex, I've just received a report about that at the same meeting, just coming up on an hour ago. Probably will have additional information for you on that tomorrow as well. And then in terms of the more general question about universal testing, so there's really 3 levels of testing that I think are important to keep in mind as we think about this. The first is testing all individuals and staff at a facility once an outbreak has been confirmed. Our new capacity will allow us to do that. Our old capacity allowed us to do that, but with a little bit of heartburn, because almost every day we were taking a look at the volume of reagents we had on hand. With the new capacity, we'll be able to test outbreaks when they occur. The medium tier is targeted testing. So if there's just been one case at, say, a long-term care facility, testing all the individuals in that confirmed case is orbit. And then there is the other tier, which is testing every single person and staff member at a facility when there have been no cases and no one with symptoms. That's still something that we're thinking through, and in those situations, we ask facility operators to give us a ring first so we can walk through them, how they may want to go about that, and what other potential things they want to think through first. I am going to, before I go too far down the list, going to go back up to Amy Brown. Amy, I know you had started a question about recovered individuals. Could I turn back to you?
Yes, thank you. I'm sorry the call dropped in the middle of that question. It was about retesting people after they had tested positive, and then whether they were symptomatic or asymptomatic, they eventually cleared and met the criteria for recovered. And now some people are starting to test positive again later. There was a report today that 13 sailors on USS Theodore Roosevelt are in that situation. Have you seen that in Maine? Have you had anyone who has been cleared as recovered who later tested positive again? And do you have any thoughts about whether that's a testing issue or some residual DNA or whatever it is left in as a marker of the virus in the person?
Great.
When they take the sample?
So Amy asks about retesting individuals after they've tested positive and have gotten better. Amy, I'm aware of the report that you noted. It hasn't been fully, I have to, all the data are still coming in. However, there are 2 phenomena that can happen that are not cause for concern. The first is that after someone has been ill with COVID-19, they've had all the symptoms, they've been laid up in bed, they might have been in the hospital, they can get better based on the criteria that the US CDC has offered. And if we give them a test, it may not be a nasal test, but it might be a test from some other bodily fluid, there might be still a couple of particles of DNA that can be found. But that does not mean that the person can still infect other people. There might be, as you said, some random strands of RNA or DNA that are still scurrying around the person. but that doesn't mean that the person has live, active virus that is capable of causing an infection. Another scenario that's possible is that if someone is in a congregate setting, like, for example, a battleship, or in that case, the USS Theodore Roosevelt, they might get sick, they might get better, the virus might come back into their body after that, but the antibodies in their body might prevent them from getting sick and might prevent them from spreading it to anybody else. In both situations, there's not a huge amount of cause for alarm based on what we know right now. But as you noted, this report just came out. The scientific community is looking at it. And as with all viruses, as with all outbreaks, we may learn something that we didn't know before. So much more to come on that as the science evolves.
Thank you.
I am going to turn next to, let me just say one more thing about this, Amy. It goes back to the first instance. Our testing, our ability to test for small pieces of DNA in someone's body are so good now. We can detect just a couple of strands of DNA in a specimen from just about anybody. But that doesn't mean that you've got the virus in a way that will make you sick or in a way that would lead you to transmit it from others. A lot of it is a fact that the tests now are just so accurate and so able to detect minuscule amounts of virus, but that's not the same as being ill and being able to transmit it to others. I'm going to turn now to Dan Newman from the Maine Beacon.
Hello, Dr. Shaw. Thanks for taking my question. You mentioned last week that Maine is still well below the 100-person goal for contact tracers. Are you considering, as some other states have, like conducting a broader hiring or a volunteer program, or even calling in the National Guard, as some other places are considering?
So Dan asks about contact tracing, and Dan, we have always been in contact tracing occurs for each and every infectious disease that Maine CDC works on, almost all. And for COVID-19, each and every positive case has been contact traced. We've been steadily increasing the number of individuals at Maine CDC who are engaged in contact tracing as our case counts have gone up. Our projection for the peak of the number of individuals necessary is around 100. But I don't want you to think that we've fallen short in some way. Expanding contact tracing is a stepwise process. As more individuals test positive, we continue to bring on more individuals. We're not in a position to bring on 100 today, only to have a large number of them not have cases to contact trace. So our plan is to hire responsibly and hire in a stepwise fashion so that as the demand increases, our supply of contact tracers increases with it. That's what we've been doing all along, and that's what we're continuing to do now. I'm going to turn next over to Patrick Whittle at the AP.
Thank you very much. I'm curious if there's any new guidance about what school reopening could look like in the fall, or if there's anything new on that front. And also, you mentioned last week that there was some concern about dropping uptake in immunizations for children. I'm curious if the CDC or the immunization program is going to do anything to try to get the vaccine to families that need them, since the healthcare system is challenged so much by this, and because of the situation that we're in is a little bit atypical.
Mm-hmm. So Patrick's first question is on updates around school reopening. Patrick, Commissioner Macon, as you know, discussed this. I don't believe there's any updates since her appearance last week here. We can check with the Department of Education, but I don't believe that there's been any further updates from them with respect to school reopening. There's a large team of folks across the administration, including people from Maine CDC, who have been working with the Department of Education to think through that. I know there's a lot of active discussions ongoing. Commissioner Macon and I have discussed it, but I don't think there's anything new on that front. In terms of vaccine delivery, we are looking at alternative ways to get vaccines out to folks. All that being said, one of the most tried and true ways to deliver vaccines is through the well child visit. So our first step, it has been to encourage parents to schedule those well child visits, because although it's critically important that each and every child get their recommended vaccines on the schedules, it's also important that the well child visit occur to look out for other issues that might be occurring. And so although we are looking at alternative ways to deliver vaccines, we really believe that the optimum way to do that is via a well child visit, underscoring the fact that pediatricians' offices, family practitioners' offices across the state have come up with alternative ways to ensure the safety of Maine children and their parents, even during these difficult times. We're looking at all the options, but the well child visit at the doctor's office with the doctor is really the way to do so. As I also noted last week, Patrick, some practices are even able to deliver the vaccine in the clinic, but not have the child even come in. So they'll bring the vaccine to the parent's car, do a quick well child exam in the car, rather than even letting the child come in. So we believe that that's really the best alternative, or the best avenue, although we're looking at other alternatives as well. I want to go back really quickly to Dan Newman's question. Dan, you asked, I did not answer, about our opportunity to use volunteers and including the National Guard. We are looking at using volunteers. We continue to ask individuals who are interested in registering at Maine Responds. We are looking for a significant commitment. Contact tracing is a full-time commitment. So we're looking for any volunteer. We would love to have you join our force of contact tracers, but we would be looking for a longer full-time commitment for at least a 2-month period, as opposed to an occasional commitment. That just speaks to the need to have contact tracers build a relationship with the individual patients that they're following, rather than just a more short, limited time. And then as to the Guard, at this time we're not looking at using the Guard, but that option remains on the table. I'm going to turn next to TJ Tremble over at ABC 7.
Thank you, Dr. Shaw. My question is actually coming from, there's been a gentleman the last few days who's been emailing just about everybody who's on this call, and I'd just like to paraphrase because it's been at the back of my mind as well. Is there a target number of tests that's needed in order to start reopening the places that are still closed?
So, you know, it's I hear your question, TJ. TJ's question is about the number of tests we need. And it presupposes that there is a straight line, that if we get to a certain number of tests, then reopening can happen or should happen safely. As the governor noted, reopening is not a monolithic thing. There are different types of reopening that are occurring across the state based on the local conditions there. And even across sectors, not all sectors are reopening at the same time, given the different risk profiles they've got. The relationship between testing and reopening is that as more individuals are out there interacting with each other, it's possible that there will be increases in transmission. That's how the virus spreads. We want to have as robust of a testing architecture and as a backdrop in order to be able to detect not just individual cases of transmission, but clusters, if not outbreaks, if they were to occur. So it's not that we need to have X number of tests done being done every single day before we're able to get to a reopening phase. It's really that we want providers, healthcare providers, to know that if they've got patients that they would like to have tested, they should not be worrying or need not worry about resource constraints at the Maine CDC lab before they send those samples up to us. That's the change that's made today. The overall calculus about reopening is partly based on having that capacity overall, but also based on other public health suppression goals or mitigation goals. That includes what Dan Newman was asking about with respect to having more contact tracers, things like that. So although there is a link between testing and these other activities, it's not so much an absolute number of tests that needs to occur. That's part of it. We want more testing to occur, but it's just as much having providers have that psychological knowledge that they don't need to be gun shy about ordering tests on patients because of the resource constraints that, candidly, our lab faced last week and that a number of public health labs continue to face to this day.
If I could, Dr. Shaw.
Yep.
Is there a nexus between the 2% positivity and the total number of daily testing?
There is, but it largely depends on what the positivity rates are. The goal, of course, is to bring all of this down to around 2%. Based on where we are right now, that will entail a significant scale up in the number of tests, but it also depends on whether we detect other outbreaks, other pockets of new disease out there. So it is, the two do change week to week based on as we see new outbreaks and things like that. So again, it's not so much about an absolute number of tests, although clearly there are reports out there that prescribe an absolute number of tests. For my colleagues and I, when we talk about these issues at our evening calls, we're really looking more about overall capacity, knowing that with that capacity in hand, physicians and healthcare providers will be able to order the tests without fear that they're running up against resource constraints.
Thank you, sir.
You bet. I'm going to turn next to Kate Koff at the Ellsworth American.
Thanks, Dr. Shaw. I have two questions. I'll ask them both and let you answer. The first is a follow-up from what we talked about on Friday, where you said that hospitals are not allowed to bill government-run insurance programs like Medicare and Medicaid for PPE. And so I guess my question would be, are they allowed to bill private insurance for PPE? And then my second question is, we've been hearing from a number of people who are wondering if you could give us an update on the number of non-residents who have tested positive while in Maine. And, are you going to be reporting those numbers more frequently going forward as we start to see travelers and visitors come to the state for the summer?
Sure. So Kate asks about whether hospitals can bill private insurance. Candidly, Kate, that would probably be more of a question for Bureau of Insurance and what the rules are. It may vary insurance company by insurance company, so I would probably refer you over to them. I can speak only to the federal healthcare programs, but as to private insurance companies, I'm not sure what private health insurance companies allow hospitals or other healthcare providers to bill for. In terms of the number of out-of-state individuals, we'll get the latest numbers. As of last week, if I recall, there were approximately, and I'm going on the approximates, there were approximately 30 individuals from other states who had tested positive in Maine, and about that same number of Maine individuals who had tested positive in other states. As we go into the summer, we're going to look to see how we can provide those numbers, but a lot of individuals who come here are only here for a day or two, and thus are then, if they do get tested in Maine, would be back in their home state by the time the test result came back. So we've really got to think through how we portray those numbers. A lot of the individuals who had tested positive from other states, a large fraction of them were New Hampshire residents. I am going to turn to the last question today over to Megan from WMTW.
Thank you, Dr. Shaw. I have a question. If we could go back to the outbreaks that you talked about for a second. Really quickly, do you have a number associated with the Bristol seafood outbreak? I didn't record one, as in a number of how many positive cases there are.
Absolutely, Megan. Apologies if I skipped over it, but the number is 5.
5, okay. I probably just missed it. Thank you. And my other question has to do with the Chinbro construction site. When you mentioned that it's across many states, do you have an idea of how many states that is exactly and which states they are? So is it generally New England or from other places? And following up with that, if you're investigating whether it came into Maine or goes out of Maine, once you have that answer, what do you do with that information?
So in terms of the number of states, that investigation is underway right now. in terms of how many of the positive cases associated with this facility, where those states are. I know that some of the states are as far and reaching as Wisconsin. We may discover as we touch base with more contractors and subcontractors that the number of states and their geographic expansiveness is even wider. But your question then is, what do we do with that? Well, as part of any outbreak investigation, part of just what epidemiologists do is try to figure out the order of transmission. That's kind of what contact tracing is about, in a sense. We're first and partly looking to see who an individual confirmed case may have spread the disease to, but we're also looking to see who they may have gotten it from. And that's part of how we construct maps on the chain of transmission, as we call it. What we do with it may depend. So it may yield insights into what ways that construction sites, how can they keep themselves more healthy at construction sites. If we determine that there was one individual who was responsible for spreading it to many, then that points us into one direction. If we determine that a lot of the transmission occurred because a number of individuals were in enclosed spaces, that points to another type of piece of information. It might also help us figure out other ways that that construction workers can stay safe on the job. If it turns out that there were 300 people on the job site, and of those who got the disease, it turns out that they hadn't been fit tested, for example, that points us in yet a third direction. So really, as we think about making prescriptions, as we think about making policy recommendations, where we have to start is with the facts. And then we look at those and see, as compared to other construction sites, where can we do better? So it's not so much that we do these investigations with a policy avenue in mind at the end. We gather all the facts and then see what that tells us relative to other investigations. Those are all the questions today. I wanted to go back to the testing piece. This announcement today that Maine CDC's laboratory will be able to conduct a total capacity of up to 7,000 tests per week is really a game changer for us. Other states have, for many months now, for at least 2 months, have had to contend with continual threats of being out of reagents and having to turn off testing for COVID-19. With today's announcement of this greatly expanded capacity and a steady supply of reagents, Maine becomes among the first wave of states to completely remove all prioritization for individual patients, allowing healthcare providers not to have to worry about testing individuals with any symptoms, as well as allowing them to test individuals who may have been exposed or are suspected of having COVID-19. It will also equip us to continue working with congregate care settings after they've developed outbreaks, as well as perhaps even before they've gotten to that stage, depending on the circumstances at that facility. For all intents and purposes, this news today, this game-changing news, will allow Maine to conduct testing in a much more widespread and expansive fashion. This is a big step forward for all of us in the state as we continue to navigate the COVID-19 situation. I'd like to take a second to thank our team at the Maine CDC laboratory. Ever since we inked the deal with IDEXX, they've been working long days and even longer nights, undertaking the scientific validation that was necessary to get us here. They've done several weeks worth of science in 1 week in order to allow us to be online today and allow us, the governor, and me to make the announcement that we are ready to go with expanded testing. We hope to see these numbers reflected, recognizing that expanded testing may mean increased numbers of may mean increased numbers of cases. That's anticipated, but it's a system that we want to have into place so that we know we're detecting cases that are already out there rather than not detecting them and allowing those individuals to potentially spread COVID-19 to others. So I really do thank our lab staff for getting us to where we are today. We would not be here without you. So to everyone at the Maine CDC laboratory, thank you so much. my hat goes off to you. So with that, thank you all for tuning in today. We look forward to chatting tomorrow.